No. Oh, I have to scan the room.
Hello, I'm Becca. I'm going to be your student nurse today. I'm going to shut the door for some privacy. I'm going to come over and wash my hands. Do you have any allergies?
Nope.
Okay, are you in any pain?
Nope.
Okay, so now I'm going to check your name band. What's your name?
Paige Stankus,
And your date of birth?
11/04/93.
Okay, do you know where you are?
UDM,
Okay, and do you know the date?
November 30th.
Okay, she's alert and oriented times 3. There's no obvious body odor. She appears her stated age, and there's no pain, and she's not allergic to anything. So now we're going to start our head-to-toe assessment. I'm going to start up at your hair. I'm checking for any lice or lesions. Okay, and there are none present, and the hair is evenly distributed. We're going to come down, and her face is cool and dry to touch. I'm going to start with your eyes. If I can have you follow my pen light in. Okay, and there's convergence and accommodation. And now I'm going to have you stare straight ahead, and I'm going to check cranial nerve 3. And her pupils constrict consensually. And now I'm going to move on to her mouth. Can I have you stick out your tongue? That's cranial nerve 12. Can I have you say ah? That's cranial nerve 9. And I'm checking her tonsils, which are grade 0 because they're absent. And I'm going to check her buccal mucosa, which is clear, and her cheeks are pink, and all of her teeth are present, and there's no lesions in her gums. Can I have you puff out your cheeks? And can I have you smile and frown and raise your eyebrows? That's cranial nerve 7. And now I'm going to come down and do her carotid, palpating one at a time. And I'm graded as a 2+, and now I'm going to listen to it and check for any bruits or whooshing sounds. So can I have you take a big deep breath in and let it out and then hold it. Okay, and I'm going to have you do the same thing for the other side. Breath in, out, and hold. Okay, and I didn't hear any whooshing or bruits, which is a good sign. And now I'm going to move on to her arms. They're cool and dry to touch. Her hair is evenly distributed, and there's no obvious lesions. And now I'm going to do her brachial pulses bilaterally. I'm going to grade those as a 2+. I'm going to come down and do her radial pulses. Also grade those as a 2+, and then I'm going to check her hands. And there's no clubbing in her fingernails, and I'm going to do a capillary refill. And it's instantaneous. And now can I have you grasp my fingers and pull down? Okay. So she has muscle strength in her arms, which is good. And now I'm going to go on to her lung sounds. I'm going to listen to 8 spots on the front, 2 on the side, 8 on the back, and 2 on the side again. So I'm going to have you take a deep breath every time I set it on. Okay, now I'm going to go on to her back and do 8 here. Okay, and there's no adventitious sounds, and while I'm on her back, I'm going to do her crostro-vertebral angle. Tell me if there's any tenderness. Okay, we're going to do the other side.
Nope.
Okay, and now we're making sure that it's 2-to-1 ratio, as it is, which is the correct proportion. Okay, and now we're going to come and do her heart sounds. So I'm going to start on the right second intercostal space, which is the aortic. Okay, and then her left second intercostal space, which is the pulmonic. And third intercostal space, which is the herbs. fourth intercostal space, which is the tricuspid. We're going to go down to the fifth midclavicular intercostal space, which is the mitral, which is also the apical pulse that you listen to for 60 seconds. And when you're up top, S2 is heard louder, and down below, S1 is heard louder. And now, do you have to use the restroom?
Nope.
Okay. I'm going to have you lay down. I'm going to check your abdomen. Is it okay if I pull your shirt back?
Yep.
Okay. I'm going to inspect before I touch it all. I'm going to get down low to make sure that her stomach is flat and non-convex or concave, and it is. And so now we're going to start by auscultating, starting in the right lower, because that's where the cecum is, so the vowel sounds are heard louder. And if there are no vowel sounds, you should listen for 5 minutes before you write down that there was nothing heard. And now I'm going to go and percuss. And the sound should be tympanic, except for over the liver, it should be dull. And then we're going to palpate. And in the right lower should be the appendix. In the right upper should be the liver. And in the left upper should be the spleen. And there was no masses anywhere on her abdomen, so she's all set. Pull this back down for you. And since we're here, we're going to go down to the legs, making sure that they're cool and dry to touch, and making sure that the hair is evenly distributed. I'm going to come and do your popliteal pulse. Grading it at a 2+. Come down. Do the posterior tibial pulse. Grading at a 2+, and then we're going to do the dorsal pedalis pulse, which is also a 2+. And then I'm going to check her toenails for clubbing and check them for capillary refill as well. And those should also be instantaneous. And now I'm going to do the Babinski test, going from the heel and a J up to her toes. And do the same for the other foot. And if the toes curl, that's a normal sign. Okay, so now I can have you sit up. Can I have you stand up? And I'm going to do the Romberg's test, so if I can have you close your eyes and stand for 20 seconds, making sure that she doesn't sway and that she can stand upright. Okay, you're all set. And now can I have you walk to the end of the room, checking her natural gait, and now can I have you walk back heel to toe. Okay, and her gait was straight and she wasn't wobbly, so that completes our head to toe assessment.